Hey guys, my name is Janki Patel and I'm taking Legal and Ethical Health Science and I'm doing Chapter 7 and it's over electronic health records. I'm ready. Today I'm going to talk to y'all about what electronic health records are, why EHRs are important, what forces are driving the adoption of electronic health records, the functional benefits derived from using an EHR, the different forms of EHR data, different methods of capturing and recording data, why patients' visits should be documented at the point of care, how electronic signatures work, and last but not least, describe the workflow of an office fully using EHRs. Alrighty, let's get started. 1. Define electronic healthcare. Electronic healthcare is a system of computerizing patients' medical records. It has been around for 30 years, but just now became widely adopted. EHRs include any information related to the past, present, or future, physical, mental health, or condition of an individual which resides in an electronic system. Used to capture, transmit, receive, store, retrieve, link, and manipulate multimedia data for primary purposes of providing healthcare and health-related services. 2. Electronic health records are important because it shares information from all providers involved in patients' care. Electronic health record data can be created, managed, and consulted by authorized providers and staff from across more than one healthcare organization. Track data over time. Identify patients who are due for preventive visits and screening. Monitor how patients measure up to certain parameters such as vocational and blood pressure readings. Improve overall quality of care and practice. 3. Social forces driving EHR adoption is visionary leaders in medical informatics have been making the case for EHRs for a long time. The combination of several important reports caught the public's attention and set in motion economic and political forces that are driving the transformation of our medical record system. 4. Functional benefits derived from using an EHR. Coded data is non-biased. The computer can use it from health maintenance, trend analysis, alerts, decisions, supports, orders and results, administrative processes, and population health reporting. 5. There are many different forms of EHR data: digital images, texting data, and discrete data. Digital images is a numeric representation of normal binary text data. It has 250 characters, text variable, and the number of character and the string. Discrete data, information that has been characterized into classifications based on the counts. 6. Capturing and recording data from different methods. Lab test results represent a significant portions of the pages in a paper chart. The average medical office uses a common instrument such as a scale, a thermometer, and a blood pressure cuff. The measurements are manually taken and recorded by a medical assistant. Clinicals use the EHR to write prescriptions. The order are also automatically recorded in the EHR. Capturing data. History and symptom information can be entered directly by the patient on a computer. If providers include to use a diction, a transcription of exam notes, the word processing file in which that transcription is saved can be directly as EHR test records. 7. Why patients' visits should be documented at the point of care. Documenting a visit at a point of care ensures more than accurate record, provides the most benefits from the system, and allows the note to be completed before the patient leaves the office. 8. How does the electronic signature work? All types of records in the patient's chart must be signed by an authorized individual, and EHR signatures are electronic. An electronic signature is not a signature you can create with a pen on paper, but rather a computer that meets these criteria: message integrity, non-repetition, user authorization. Message integrity means the receipt confirms the document has not been altered since signed. Non-repetition is the signer must not be able to deny signing the document. User authorization. The receipt must be able to confirm the signature was signed by the real person. 9. Describe the workflow of an office fully using EHR. Here are the 12 steps. 1. Patient calls the doctor's office for appointment. 2. The day before the appointment, medical office computer electronically calls and confirms appointment. 3. The day of appointment, patient arrives and is asked to confirm a demographic info. 4. Medical assistant or receptionist asks the patients to complete a medical history and reason for today's visit. 5. When patient is done with the questionnaire, the system lets a nurse know that the patient is ready for exam room. 6. The patient and the nurse review the patient's entered symptoms and history. 7. The physician performs the physical exam. The clinical typically makes a mental provisional diagnosis. 8. The clinician prescribes a treatment, medication, and orders a further test using the EHR. 9. If lab work has been ordered, a medical assistant will obtain the necessary specimen and order is sent electronically to the lab. 10. In many systems, the provider can display and annotate pics of body areas for patient's education. 11. The patient is escorted to the checkout area. 12. If lab tests are ordered, the results are sent to the doctor electronically and are reviewed on the screen and automatically merged into EHR. Alrighty guys, that's it. Thank you for watching.